Well, the summer travel season has gotten a little more complicated with the arrival of the highly contagious BA.5 Omicron variant. It now makes up 65% of all cases, but there are some simple ways to lower your risk of getting infected. The Fox Medical Team's Beth Galvin here with us live to talk about that. And Beth, you're hearing that people are getting reinfected, but there are ways to keep yourself from getting infected again.
Yeah, I think reinfection is a really big issue, Christine, with this particular Omicron variant, and that's because it's just so contagious. So we asked a senior White House doctor for advice on how you can keep from getting infected or reinfected for that matter, and he came up with a simple checklist of 4 ways to lower your risk. By now, you've probably already heard about the Omicron BA.5 variant, the most transmissible one yet in the pandemic. But White House policy advisor Dr. Cameron Webb says BA.5 is also pretty good at reinfecting people sooner than we've seen with other variants.
Well, for much of this pandemic, people have thought that if they had an infection within the last 90 days, they were safer. With BA.5, we're seeing reinfections much sooner than that, in a matter of weeks as opposed to months.
So Dr. Webb offered up a checklist for navigating BA.5. First, he says, make sure that you have at-home COVID-19 tests and swab yourself even if you think you can't possibly be positive again.
So if you had COVID within the last few weeks and you suddenly develop symptoms that feel like a cold, it's still important for you to test again, because that's going to help you figure out how to keep the people around you safe, how to minimize the ongoing spread of disease.
Next up, if you do test positive, isolate and move quickly.
And the first thing you should do is reach out to your healthcare provider if you have one. Make sure you talk to them about whether or not treatments would be appropriate for you.
You may be eligible for Paxlovid, an antiviral pill designed for people at higher risk of severe COVID-19. It's available at no charge if you don't have health insurance, and it can lower your risk of ending up in the hospital or dying of COVID-19 by 90% if it's taken within 3 days of developing symptoms.
And even if you had COVID recently and it was a mild case, that doesn't mean that the reinfection is also going to be a mild case. So it's important that you consider getting treatment for that.
Next, Dr. Webb says, get up to date on your vaccinations and boosters. Don't wait, he says, on a more targeted booster or boosters still in development.
But until they're available for you, you need to take advantage of the tools that are currently available. If it were me, I would get that vaccine today rather than wait for some potential moment in the fall.
And Webb says if you're in an area with medium or high COVID-19, wear a mask indoors in crowded spaces. Same thing if you're going on vacation. And he says if you're someone who might need an antiviral, if you test positive on the road, research where you can get the medicine before you go.
And then make sure you bring some tests with you, right? Make sure you have the ability to really quickly find out if your stuffy nose or runny nose is actually COVID-19. If you do those things, you're putting yourself in a better position to stay safe while traveling. It doesn't mean you can't travel at all, but what it means is you have to do so in a smart way.
And speaking of travel, passengers are no longer required to wear a mask on planes or other forms of public transportation. The CDC, though, continues to recommend wearing a high-quality mask like an N95 or a KN95 and trying to stay 6 feet apart from others. Of course, that's not possible when you're on a plane, but when you're in the terminal, they say try to keep some distance between you and other people. And Christine, I think that's, where the risk is. And it's all about, this doesn't have to stop your vacation, but you do have to kind of think about things because it can sort of sidetrack you.
Sure, because once you get it and start feeling bad, it's almost too late to try to do those mitigation tactics. But all right, something to think about. Thanks so much, Beth.
Thank you.